Okay, so I'll go through that. What you needed so much to do, or rather to know in your first clinical year, is to know how to take a good history and examination, number one. Okay, come up with a list of differentials, and then also come up with some of the investigations that you may need to do to confirm your clinical diagnosis. Okay. Management, when it comes to treatment and management plan, that usually comes in later on, maybe in sixth year and so on. But it may also come in with common conditions. For example, in our setting, you should be able to come up with the treatment plan for conditions such as TB, conditions such as malnutrition, conditions such as malaria, and so on. Okay, those, because they are very common in our setup, at least you are expected to know even up to treatment, how you treat those conditions. Okay, but with many other things, what you needed to know is taking a good history and examination. You come up with a list of differentials, and then also some plan that you may need to undertake. Okay, so let's look at history taking. I've already written that there. Okay, so now the first thing that you need to do when you receive a patient, okay, you are working in the outpatients department or the emergency department. Although in the emergency department, it's rarely that you have to start taking a very detailed history, because remember, it's emergency, so you don't always need to take a very good, a very detailed history and examination, right? So let's say you are in the outpatients department, and then you receive your patient. The first thing that you need to do is to introduce yourself. Okay, introduce yourself. Okay, now in introducing yourself, one of the things that you need to do is you also mention your title. Okay, your appropriate what? Title. Okay, you need to introduce yourself by your appropriate title. In this case, if you're a medical student, introduce yourself. I'm so and so. I'm a medical student and at such a school, and I'm here to. Then you mention your purpose, rather what do you want to do? Okay, what you mention, you state the purpose of the interview. Okay, you tell the patient what you want to do. You tell the patient, I want to take history, okay, and then examine you. Okay, I want to take history and then examine you. Now, this is something that is very important. You always need to talk to the patient in the language they are most comfortable with. Okay, talk to the patient in the language they are most comfortable with. If you are not familiar with that language, it is best if you can get an interpreter. Okay, why? Because if your patient is speaking, let's say you are using English and the patient is not so familiar, is not so conversant with English, it means that they are not going to give you the information that you need to get so that you diagnosis. Okay, so if the patient is more comfortable with a particular better and comfortable with that, it's best maybe you get an interpreter to help you as you interview your patient. Okay, so introduce yourself. My name is Darwin. I'm a medical student at the Copperbelt University, and I'm here to take history and examine. Do you allow me? Are you going to allow me to do that? So you get consent. Okay, you get what? Consent or permission from patient. Unless the patient is not autonomous. Okay, unless the patient is not autonomous, or that the patient is not able to make a decision or respond on their own. For example, it's a child. Okay, in a case where it's a child, all right, or the patient has him or herself is unconscious. Okay, if the patient is unconscious, you can get that permission from the person that has brought them to the hospital. If in case of the mother, okay, usually it's mothers that take children to the hospital. or it could be the father, whoever has taken the patient to the hospital. Okay, so you tell the person that has brought the patient to the hospital. In a case where the patient him or herself is not able to respond, you explain, you introduce yourself to them, you greet. Okay, first of all, in fact, there's greeting, by the way. There's greeting. Very important. Now, most of the times, actually, on the part of greeting, okay, it's also encouraged whenever possible. It's encouraged that you greet with handshake. Okay, you greet your patient with handshake whenever possible. And maybe in this time there are also these corona issues and so on. However, in a normal setup, it is important to do the greeting with a hand. The reason is that as you are doing the handshake, number one, you are creating that relationship and the trust with the patient. Okay, when someone shakes your hand, there is not always that connection that you make with the person that you are shaken hands with. Okay, and the person will be able to open up to you and tell you the problem that they are having and the reason why they have come to the important to do the greeting with a handshake whenever possible. Okay, so that is about greeting. So after greeting, you introduce yourself. So how are you? They respond, and you also respond. I'm very fine. Thank you for coming. My name is Darwin, and so on. And then here I'm going to interview you and also examine you. Tell me, and then they respond. Yes, I'm allowing you. You can go ahead. Most of the things they are very very important for medical legal issues. They are very very important. Okay. So you sent from the patient him or herself. In the case of the patient herself is not able to respond on their own, get from the person that is in a position to respond to you. The next of kin, it could be a relative, friend, whoever has brought the patient. The other maybe it's a person that has brought the patient. Let's say maybe a patient was just found, maybe was hit. In case where it's a hit and run kind of situation where the patient is hit with the person that hit the patient runs away, okay, and then the policemen bring the patient to the house. In such cases as well, you can also get that consent from a police officer, for example. Okay, so that's about that. Then from there you get what is called the demographics. Okay, or okay, and you need to get. These are things that are going to help you identify the patient. Okay, they are going to help you identify the patient. Now, it will help you identify surname. Okay, they'll have the same Chandamulenga, especially now Bembas, they love names. Okay, or maybe this one is Chanda, the other one is Mulenga Chand. And yourself, so you always need to know these things. So number one, you get the name. The reason why you need to get the name is for identity. Okay, basically for identity purposes. All right. Number two, you get also age or date of. Now, why do you want age and date of patient? Number one, it's because certain conditions are more common in certain age. Some conditions, so in other words, some conditions are age related. Okay, some conditions are what? Are age related. For example, cancer. Hey, come on. Why? How? Okay. So we are not saying that it is totally impossible for a child to have lung cancer, all right? But we know that some of these things are more related to higher age groups, patients. It comes, okay, an old patient, and then you start asking things more related, let's say sickle cell disease, okay? Then it's not going to make so much sense. So you always need to ask for age, you a clue. From there, you can start thinking of some of the conditions that the patient may be having. Okay. Okay, I've just, I think I've removed it. Oof. All right. So I was talking about age, which will help you be able to anticipate certain conditions that are related. Okay. Then number two, also for identity purposes. Okay, also for identity. For example, if there are two patients, with the exact names, but one is let's say 24 years old, then you'll be able to make a distinction. Oh, my patient is this and they are so much old, right? It's also for identity purposes. Number three, okay, sex. So now, just assume, okay, we see that sometimes it's obvious, and in the situations it cannot be so obvious that this one is male, this one is female. There are all these transgender issues, okay? Or in example, a child, you cannot really tell if this one is female or this one is male, isn't it? It's not always that you can tell. So you need to ask the child male or female. Other than that, there is what is called um, ambiguous genitalia. Okay, for example, ambiguous genitalia is where a child has, you cannot really tell if the child has the sex organs that the child has, whether they are for a female or they are for a male. Okay, so those are situations that you're going to encounter. All right. So now, the reason why you need, okay, the most important reason is sex related. Okay, there are sex related conditions. For example, an example is hemophilia. Okay, an example is hemophilia. This child, okay, and this patient. So the fact that it has come with the complaints of bleeding, although at this point you've not really started asking about what is wrong with the patient. Later on, you start asking what is wrong about the patient. But you knowing that this patient is female, it makes you exclude, almost entirely exclude the other patients. You can't start asking about pregnancy-related issues in a patient. How? Okay. So when you know this, you are going to anticipate certain conditions that are female or male gender. Other than that, also identity. Okay, so we know that there are certain names that are unisex. They are used both in females. Okay, so you have two patients with the exact same names. Okay, but your patient is female, the other patient is male. So you are going to know that okay, my patient, even my patient is female and not male. That is also going to help you identify your patient. Okay. From there, you can also talk about. You can also ask about marital status. Okay. Now, one thing I should mention is that uh, this that we are mentioning here, please, some of these use your own wisdom. There's no way a child, a child 5 years old marital status. Really? Okay. Okay. So in such cases, okay, in such cases, there's no need of you asking about marital status. So these are not really formulas that you need to satisfy yourself. And no one is saying that you must ask out. No, that's not what we are saying. Okay, so it depends on the situation. So if you see the patient is let's maybe especially maybe after few hours and order and so on, you can ask about marital status. Now, why should you ask about marital status? The reason why you should ask about marital status is because of sexually transmitted infections. Sexually transmitted, excuse me, infections. Okay. Other than that, okay. Other than the reason why, other than the aspect of sexually transmitted, example, uh, in a case where if this patient is married, okay, if the patient is married, all right, and then you find that this patient, you do your history, your examination, your investigation, the patient has is positive, okay, and then the patient is married, then you are going to be worried about the partner, isn't it? You're going to be worried about the partner, okay. So how you also disclose that information, okay, for legal purposes, how you disclose the information that you have found about the patient also matters. All right. There are certain things that your patient will prefer not told to their wife or maybe their husband. Okay. For example, if you find that they're HIV positive, all right, no one in any case, the patient's information is supposed to be confidential. Okay, it's supposed to be confidential unless your patient allows you to disclose their information to someone else. It could be their spouse, it could be their relative, it could be their sibling, and so on. Okay, that's when you can do that. Now, specifically in the case of marriage issues, you find that the couple may start having what? Marital issues. Okay, or maybe, for example, this patient comes with things such as um, uh, 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 erectile dysfunction problem. Okay, and then you know that they are married, so you're also going to worry about their marriage. If this patient is having erectile dysfunction, then it means that their marriage is going to do what? It's going to suffer. Okay, it's going to suffer. So it's going to help you. Knowing the marital status will help you know, number one, what they are likely predisposed to. Okay, some of the conditions that they are likely predisposed to. Number two, some of the effects of the conditions that the patient may be suffering from on the marriage. Okay, those are some of the reasons, not limited to that though. Okay, then other than marital status, you also need to know about occupation. Okay, you also need to know about occupation. What is the occupation of your patient? What does the patient do? Okay, now, one, the reason why you need to know about occupation is to know their socio-economic, okay, socio-economic status. It will help you anticipate their socio-economic what? Status. If this patient says, the patient comes and says that I am a garden boy, okay, you receive a patient and the patient says I am a garden boy, and then after you do your history and examination, you realize that you need to order, let's say, for example, for a CT scan or MRI or some other expensive investigation. Then you have to be mindful that the patient that you are asking to pay for such orders is most likely not in a capacity to pay for those services. Okay, and you have to come up with a way of helping such a patient. For example, you can refer them to the social welfare department where they can be helped with such issues. Other than that, you also want to know, okay, there are also what are called occupational diseases. Okay, occupational diseases. Okay, there are a lot of occupational diseases, and some of them, and maybe let me also say hazards. Okay, and hazards. All right. So because of the occupation, the work or the job that someone does, they are more likely to suffer from a particular condition than someone that does not work in such an environment. Okay. So basically, those are some of the things. Other than that, before I forget, you also need to know their ethnicity and religion. Okay, ethnicity and religion. Okay. So, for example, there are certain religions which will not allow a male doctor, okay, a male clinician to examine a female clinician. There are some of those religions that are like that. So you need to be careful. Otherwise, you're going to be sued. You just graduated and found a job. You start working as a doctor, as a junior doctor, and then you get sued and your license is revoked for simple issues. Okay, so you need to know about that. Other than that, for example, like in our setup, okay, most people are Christians. All right, most people are Christians, but Under Christians, we have different denominations. Others are Jehovah's Witnesses, others are Pentecostals, others are Seventh day Adventists,